Hello everyone, I am Professor Sang Moon from Seoul National University College of Medicine. This lecture is about basic skills in colonoscopy and polypectomy. The contents are colonoscope system, insertion, withdrawal, and polypectomy techniques. It consists of a connecting section, control section, and a distal end. And the other is for right and left angulation, suction valve button and air and water valve button and the function key buttons are also on the control section. The diameter of the shaft is between 10 to 14 millimeters. When the button is covered, air comes out from the distal end. Depressing the button, you will see water squirting to clean the lens. The left video shows cold snail polypectomy for a diminutive polyp. In order to prevent deep thermal injury to the colon wall, the polyp head, once tightened, should be tented away from the wall toward the colon lumen.